Well, good morning, everyone, and welcome to today's webinar, which will be on trauma-informed practice and trauma-informed principles applied to real-life examples. Please feel free to keep introducing yourself in the chat as you arrive. Please note that this is a webinar setup, which means that only the panelists are visible on screen. So if you can't see yourself, that's normal. It's not a technical glitch or anything like that. The session is being recorded and will be shared on YouTube and on our website later. And I'll share the link to the recording with you all. There will be opportunity to ask questions at the end. If you've got any questions during the session, please feel free to put them in the Q&A box. So if you look at your toolbar, you'll see there's a little Q&A box at the bottom. Just put in any questions you've got in there and we'll pass them to our panelists at the end. So before we start, just want to say a little bit about Changing Futures. Changing Futures is a resource for Bristol. We're a programme funded by the Department for Levelling Up Housing and Communities and the National Lottery Community Fund. We work as a partnership to improve local services for adults and young people who face multiple disadvantage. Our aim is to create sustainable change at individual, service and system levels and to influence government policy and local commissioning. We can't change the system on our own, so we're particularly grateful to see you here today because you being here is a first step to us changing the system together. We know that trauma is heavily prevalent in our client group, and for this reason, we're committed to supporting the system to embrace trauma-informed approaches. We use Bristol, North Somerset and South Gloucestershire's knowledge and skills framework, which lays out 6 principles of trauma-informed practice. Today's webinar is going to be looking at each of those principles and how that translates to work examples. So I'll introduce our panelists. We have Helen Hemmings, who's our Changing Futures trauma-informed lead, and we have Hazel Renouf, who's our who's the trauma-informed systems manager for the local integrated care board. Sorry, Hazel. You will also be shown a number of videos today from Independent Futures, who are our consultants with lived experience. So prior to this webinar, we consulted with Independent Futures, and Corrado, their manager, interviewed members who will be giving us video testimonies of their experience of trauma-informed practice. So to kick us off, Hazel, do you want to tell us a bit more about how those trauma-informed principles came about?
Yeah, sure, thank you. And don't worry about the job title, it's a mouthful even for me. So just to provide a bit of context and background to the work. So in terms of a definition, or what are we even talking about when we talk about trauma and adversity? So in November 22, the government published a definition of trauma, saying that it's resulting from an event or a series of events or a set of circumstances that's experienced by an individual as harmful or life-threatening. And while that's unique to the individual, generally the experience of trauma can cause lasting adverse effects, limiting the ability to function and achieve mental, physical, social and emotional and spiritual well-being. So in Bristol, North Somerset and South Gloucestershire, we talk about trauma, but we also talk about adversity. The reason why is because people with lived experience describe that sometimes they find it hard to connect their experiences of trauma to that word. And I guess they struggle to connect with it, and they feel that some people might not even heard of the term trauma. So it might not have any meaning for them as a person. And language is really important in that sense, in terms of being inclusive. So it's something just to be mindful of. And the word adversity, I guess, is just a reminder that adverse experiences can also be stressful and can also be very traumatic as well. So research has shown that traumatic events are more frequently experienced by people from low socioeconomic groups and also from Black and minority ethnic communities, and those who've experienced adversity within childhood. For this reason, it's really important that when we think about trauma and adversity, we're viewing that from an intersectional lens. And what that is just to consider the social, personal, and often political context to where these experiences are happening or how they've happened in people's lives. There's also a growing evidence base demonstrating that large numbers of people in contact with our services and then with public services have experienced traumatic events, which is why this is so relevant today. There's also been real increased interest and understanding of what's called secondary and vicarious trauma within the workforce. And what that means is that we can all be impacted by exposure to trauma in others and by hearing traumatic events and adversity to the people that we're trying to support. In terms of COVID and the global pandemic, I think it's important to mention because it impacted all of us in some way. Many of us experienced personal loss, feelings of fear or lack of safety, or changes to our socioeconomic circumstances. And experiences of trauma and adversity brought about by the pandemic also disproportionately impacted Black and minority ethnic communities, people experiencing poverty, and compounded experiences of those who've already experienced multiple disadvantage in their lives. So in terms of trauma-informed practice and what it is, the development of trauma-informed practice mostly can be traced back to the USA, but there's a real growing evidence base and work in Britain and with Wales and Scotland kind of leading that way or have done up to this point. So it leads back to the work of Maxine Harris, of Roger Fallett and Sandra Bloom. Something called the 4Rs model is developed in the US by the Substance Abuse and Mental Health Services Administration. But what they do is they describe a program or an organization or system to be trauma-informed when it realizes the widespread impact of trauma and it understands the potential paths to recovery. Also needs to recognize the signs and symptoms of that trauma in the people that they serve and also in their families, staff, and anyone else involved in that system. And what it's trying to do is resist re-traumatisation. So it's actively trying to think about how to resist that through what the services they provide. And it really responds by thinking about all that we know about trauma and adversity, and then trying to link that into the policies, procedures, and practices of organisations. So locally, as Sarah Jane mentioned, we've adopted 6 key principles that underlie trauma-informed practice, and they've been adapted by Fallett and Harris, and the principles that they came up with around this work. And they're safety, choice and clarity, collaboration, trustworthiness, empowerment, and inclusivity. And I'll hand over to Helen, who's going to look at those in a bit more detail and kind of give them the context in terms of people's life experience.
Thanks, Hazel. Thanks very much. Okay, so many of you may already be familiar with the trauma-informed principles and what they mean, but for those of you who maybe aren't from Bristol or maybe who are using different principles in your areas, I thought I would just give a quick summary of the 6 principles that we talk about with trauma-informed practice here in Bristol. So with the 6 that we list as being the areas that we're going to be focusing on are safety, choice and clarity, collaboration, trustworthiness, empowerment, and inclusivity. So this morning, what we're aiming to do is to draw your attention to each of those principles in turn and give them a little bit of context, and then think a bit about how we can apply those principles to the practice that we deliver. So whilst you might be familiar with those principles, we know that it's quite difficult sometimes to connect them in reality, and that's some of the feedback we've been getting from Changing Futures, is that actually we've maybe done a bit of training around trauma-informed practice, or it's something that's on our radar, but actually how do we know when it's coming up in our work and what do we do with that? So we're looking this morning at some tangible ways that these principles might present in your practice, how we might respond to them, and then highlight how those principles might be experienced through the lens of those who maybe live that experience. So we've got the help, as SJ mentioned, of lived experience representatives from Independent Futures. So we'll be cutting into each of their clips as we go. So this morning we'll be looking at each of these 6 principles and the perspective of lived experience. It's really important to recognise that trauma-informed practice is a process. It takes time, and to be truly trauma responsive can take a really long time. So today, what we're not expecting is for expertise by the end of this. We're aiming to highlight some of the things that can be done in practice But this isn't exhaustive. There'll be many, many ways in which you can enhance trauma-informed practice, both with the people you support and within your organisations. We're really hoping to demystify the concept of trauma-informed practice, to draw your attention to where you're probably already practicing in that way, where you're already applying the principles, but not necessarily naming it as that. This isn't about you behaving differently necessarily, but about pulling together your thinking and practice around the principles in front of you. So let's first examine trustworthiness and transparency. So many people facing multiple disadvantage have experienced complex trauma and will have really good reasons why they don't inherently trust people or services. In reality, for some, not trusting people has been what's enabled them to survive. So we shouldn't be surprised that trust isn't automatic. Having a job title or a name lanyard or a business card or a professional role or an office isn't sufficient to engender trust. Trauma also often brings with it feelings of shame and unworthiness. And so asking someone to speak about their experiences requires that we overtly demonstrate our trustworthiness. It's not innate. Building trust takes time and patience and requires that we consider how our behaviour helps or hinders the building of a trusting relationship. For example, reliability and consistency are fundamental to practicing in a trustworthy way. We only offer what we can actually deliver. We do what we say we'll do, we don't overpromise, and we're on time and ready to dedicate that time to that person. These might sound like really obvious and small things that we all do automatically, but they demonstrate respect for the individual that we're supporting, and they show how we can be relied on. So it's really important that we don't underestimate these skills. And it's also important that we're naming them as being trauma informed. They truly do respond to the experiences of trauma. So all the time that we're recognizing those things as being trauma informed practice, we can begin to take stock of all the places that we're behaving in that way. And they also offer us the key to thinking about where some of those interactions aren't working. Actually, are we really in a position where we're being quite as reliable or consistent as we'd like to be? It's really important to recognise that those who've experienced complex trauma may well have been around services for a really long time, potentially their whole lives. And so they will have been processed over and over and over again, being assessed and reassessed, having decisions made for them with little or no trust at all in the professional. So as such, it's likely that some people will offer up their personal information or tell you all about their traumatic experiences, seemingly with ease. And this is because this is something that they're programmed to do. They're entirely used to it. It doesn't necessarily mean that they trust you. So giving time and space to allow people to develop that trust means that the person can choose what to share with you and when. And they may be able to accept your support because they want to, not because they're doing it automatically as a learned behaviour. So with this in mind, it can be really helpful to be explicit with new clients that you don't expect them to share everything on their first meeting. If your systems and processes allow you more space and time to give someone to feel comfortable to share, then it's more likely that they're going to build that trust in you, that actually what you do moving forward is going to be constructive and productive for them, and it's going to create that safe and trusting relationship that they need. So we're now going to hear from Tom with his experience of trust. Hopefully.
Certainly. The principle I would select was when I was working with the Trauma Informed project, part of Bristol University. And here, in order to meet up and make engagements and make progress and talk about surveys and other reports, we needed to arrange meetings. And this was done by the person leading the project efficiently, on time, when she said she would do it, and she did it, through emails that were understandable. We arranged these times, or she did, I agreed to them, and then we met up in these environments for lunch or for coffee to discuss the progress we were making with any particular item of work we were doing. On one occasion, we met in this restaurant, and it's very busy, and we couldn't really hear each other too well, and it compromised the progress we were making. And I thought, to her credit, when I did suggest that maybe this wasn't ideal, she said, "Fine, we'll meet in a quieter environment next time," and we did, and it was near one of her offices with her colleague, and we completed the work there. And she brought biscuits along, and always got hold some treats. Yeah, so
Right.
yeah.
Right.
So it's just a nice touch, gets trust going. And so we did meet in this quiet environment, listen to what I had to say.
Yeah.
She know we had to meet at certain times. She did what she said she'd do, and she met my needs. And we managed to complete the work we were doing. And now we've got some conferences coming up in June, July. And I feel, she's invited me to go along to one of them and give
That's
a
great.
presentation. So I felt it gives you confidence, that consistent and trusting, and did what they all said they would do. Didn't just not
Fantastic.
get back to you.
Great. So I think that gave us a good sort of flavour in Tom's experience as a lived experience representative, that trustworthiness is critical to actually getting over the line in terms of getting some work done. So let's move on to collaboration. All people, want to have a say in the decisions that affect them and are impacted by imbalances of power. This applies both in our work with people facing multiple disadvantage and also within our teams and across the system as a whole. And it's really important that we consider how we can create a culture of doing with rather than doing to the people that we support. For example, being genuinely collaborative when support planning, for the professional, what seems like a priority to you in terms of that person's immediate needs might not tally with what they feel is a priority. And without collaboration, a support plan risks becoming meaningless and unachievable, something that neither of you can connect to. Whilst it might be the case that there are limits to what can be done for you professionally, collaboratively, whether that's a legal restriction or practically, finding as many opportunities as possible to rebalance power allows people to feel more involved, feel more invested, and more responsible for what happens to them. For some people who've experienced trauma, making decisions or doing new things can be really daunting, and it feels easier and safer to defer to you as the professional to make decisions. It might also be the case that when given the opportunity to take back control, they might freeze or do nothing. This is an example of where collaboration is so delicately balanced. With some knowledge of how trauma can affect decision making and confidence, we can manage our expectations of what's possible for someone by collaborating with them to reach a position that they feel supported, safe, and empowered to make change for themselves. Now, this applies equally to organisational structures too. So any opportunities where decisions that impact the staff team or your colleagues can be reached collaboratively, giving staff members a voice, will make accepting decisions far easier and will make it much less likely to create conflict. This isn't about making decisions by committee, but it is about finding those opportunities where people feel that their voices and their opinions are heard and valued. And with that in mind, it creates a culture of doing with. And as we said at the very beginning, these features of trauma-informed practice need to be visible throughout the system. So where we can be emulating what we would try and do with our clients, to be able to be doing the same things within our professional practice as colleagues is also really important. To develop the idea of collaboration further, though, we also see incredible benefits that come from co-producing services with those with lived experience. So inviting people with lived experience to contribute to the design, the development, the delivery, the evaluation of services ensures that we're collaborating at every level and not solely viewing our services through our really only very limited professional lens. So let's see how that works in practice by watching the next video.
Sorry, little glitch there. I'll try again.
Yeah, so for me, I was part of an interview panel here at Changing Futures. I had the opportunity to lead an interview, actually open an interview and lead it as well. Yeah, I think that's
Cool. So what did people do in order to enable that? How did they make it happen?
yeah, so before the interview, what was really helpful is they kind of said the structure of how, you know, who's going to say what, if I wanted to say this, or if, you know, the roles were distributed, you know, it wasn't just all one person doing everything. It was, yeah, quite cooperative.
Cool. So how did you feel about the whole experience?
Yeah, so being the first time on that side of an interview, you'd think it would be quite nerve-wracking. Obviously, there's a little bit of anxiety in that, but I think the two people that I was in the interview with were very understanding and, you know, very supportive. Supportive of, you know, if I had any questions or, you know, anything that I wanted to add or, you know, change. They were, yeah, really communicative about it.
Great. So I'm conscious of time this morning, so I will move on to the next principle. So the next principle we'll look at is safety. So perhaps unsurprisingly, safety is an absolute priority for trauma-informed approaches, because without it, people find it really hard to seek support, feel uncomfortable speaking and sharing, and ultimately find it difficult to engage with any support that's on offer. And equally, staff in services without consideration to safety are far more at risk of work-related stress, vicarious trauma, burnout, and along with that sits often their risks to their physical safety too. So we really should be aiming to provide safe and nurturing environments for everyone that access our services and everybody who is working for us. So we need to be looking to promote physical, emotional and psychological safety. Now, physical safety relates largely to physical environments, and there's a whole world of stuff around trauma-informed approaches and psychologically informed environments that we don't have time to look at today. But as a kind of potted picture of things that might be possible in the short time that we've got, we need to think about whether people know our buildings. Do people coming to work with us and for us understand the safety around our building? Can they feel that they can approach the building safely? Is it well lit? Is it located in a part of town that's safe and secure for them to access? Do people hang around outside? Is there an uncomfortable atmosphere? Or is the building welcoming? Is it well signed with accessible language? Is it comfortable and warm? Or actually, is it quite noisy and chaotic? Are we offering quiet spaces so that someone can go and decompress if they're overwhelmed for both staff and clients? So are there small changes that can be made to create a physical space that feels safe? Perhaps one thing to consider is having a walkthrough of your setting and looking with a really critical eye at the layout. Have a look at the posters on the wall. Are there things in the waiting room that might be triggering? Are there things about the building that feel uncomfortable or might be triggering or jarring for those who've experienced trauma? Small things like, do you have nice mugs for people to have a drink from? It sounds really, really small and minute as a detail, but actually demonstrating the value of somebody by honouring them with things that are not tatty and shabby actually says a lot as well about their emotional safety in that space. Is the waiting room comfortable? And is it private? do reception staff have some knowledge and understanding about trauma and its impact? Do they know how to welcome and make people feel comfortable so that the space is somewhere that anyone entering that building can feel that they know what they need to do in that space and they feel emotional and psychological safety comes largely from the interactions that we have and the relationships that we form. So communicating clearly and consistently, being friendly and honest and respectful will all help to create a sense of safety in initial interactions with people. People need to know from the very beginning that their privacy will be respected and that they can speak to you openly with you knowing that with them knowing that they can't be overheard and in the knowledge that you won't be sharing their information with others unless they agree to it. We'll all have confidentiality paperwork to be sharing with our clients in some of our early interactions, but for some that's a fairly meaningless piece of paper. So taking that additional bit of time to truly explain what that means, what they can expect from you in terms of confidentiality, thinking about overtly with that person, how you might like to work with them so that they feel safe. It's time that's spent in a very early interaction that can pay huge dividends later down the line. And also in working with people who've experienced certain types of trauma, offering to make adaptations to support their sense of safety might be really valuable. For example, offering a female worker to someone who's experienced sexual violence. Those sorts of things, where possible, can very early on set the stage for a sense of safety. And it's really also important to recognise that some people who've experienced trauma may never have felt truly safe. And so it's really helpful to have an open conversation with them about what safety actually means to them and what needs to be in place for them to feel comfortable in working with you. If someone doesn't feel safe but doesn't know how to articulate it, they might just simply disengage from your service. So not assuming that by doing these things somebody will automatically feel safe really honours their experiences of feeling unsafe. So open conversations about what safety actually looks like can again really form those intrinsically secure relationships where really great work can be done. So let's listen to SJ talk about safety.
Yeah, so me and my lived experience colleagues in IF, we have reflective practice sessions. And when I started, I was a bit worried about attending because I didn't know what to expect. And I wasn't sure about making myself vulnerable in that space. However, I didn't actually need to worry. Even though sessions were online, a very safe environment was created with people being respected and supported.
That's great. Very good to hear. What did people do to make that environment safe?
I think part of the safety of that environment was offering people choice. We all had input into what was discussed and we weren't sort of dictated to certain subjects. There was also the knowledge that the information would remain confidential so that we could be open and honest. And the group actually self-regulated a lot of the time and we kept each other supported and safe.
Right, right. It's very good to hear that you worked as a group on this one. How did you feel throughout the experience of joining the group or staying in the group?
I think the successful kind of safety environment that I felt confident to contribute and say what I was really thinking, which actually meant I got a lot more out of the sessions than I would otherwise. If the safe environment had not been created, I don't think I would have continued to attend.
Great, great. Jay, I'm very happy to hear about positive experience for you, and thank you so much for sharing.
Fab. So let's move on then. The next principle to consider is inclusivity. So when the trauma-informed principles were written for Bristol, North Somerset and South Gloucestershire, this principle was seen as being really important and was particularly highlighted by young people. For them, inclusivity means that services are accessible to them in terms of their geography and also how to communicate with them. It might well be that young people wouldn't respond well, for example, to a letter. It might be too formal or reminiscent of bad experiences with authority. And so some of those considerations around young people specifically means that there's a need to be able to respond to their experiences of trauma through the lens of their needs as young people. The recognition of individual differences and protected characteristics and a person-centered, non-judgmental approach are key to being inclusive and key to responding to trauma in practice. So while it's really important to have that understanding and that knowledge of protected characteristics of gender, ethnicity, sexuality, religion, age, and so on, it's really been stressed by the contributors to these principles that it was crucial that services recognise the uniqueness of individuals and how their individual characteristics intersect and impact on each other. In seeking to achieve this level of inclusivity, the key likely sits alongside transparency and clarity. We really should feel encouraged to ask people, clients, colleagues, other professionals across the system about their cultural values, their beliefs, and their experiences, so that they might so that these things might influence our understanding of their situation, so that making assumptions is truly avoided. We feel that these are conversations and questions that, where they come up more frequently, some of the tensions in those conversations can be relieved. It's so important that organisations think carefully about how they demonstrate inclusivity. So in the way that they communicate information, the sources they use, how the environment's organised. We should be really aware of our own diversity and how the lens through which we see the world can influence our interactions with others and vice versa. Inclusivity also includes paying attention to people's experiences of oppression and understanding wider contexts in society and the communities in which you work. So this can take the form of individual learning, of training, of research, but it's most critical to recognise that it isn't sufficient simply to sign an organisational equality, diversity and inclusion policy or to attend a standalone training session, but to actually proactively learn and practice what you've learnt. So let's hear a little bit from Tom around his experiences of inclusivity in practice.
The example I would use is one carried out by the NECG, which is the National Citizen Expert Group, can't remember what it stands for. In that, when we have had discussions online, community meetings, there has been a genuine amount of empathy shown towards other people's lived experience who may have indeed experienced certain aspects of what have been talked about. And can trigger people. And one example where I think a particularly great understanding was shown by professional staff was when we saw a film on homelessness. And it was very moving, if I'm honest. It was powerful stuff. A lot of the films they show are very powerful, moving. But there were one or two members there, one in particular, who had suffered homelessness. And it did trigger him. And although he held it together for the meeting, I think he did report back that, he hadn't felt great. He understood that the film needed to be shown. But in the next meeting, they did, the staff from the NECG did acknowledge that this particular individual had been triggered and we're very supportive to him and also very empathetic to all of everyone else there, because to not be moved by such films would be strange. So I just thought that showed a degree of compassion. And we talk about other elements of inclusivity. But I think something when you get triggered by a particular issue, which puts you maybe up a perceived emotional disadvantage. If you can let that be known to the organisers and they support you in that, that's just as important. It may not get talked about much as particular fixed issues of inclusivity.
Yeah.
But being understood, particular subject that may be out the mainstream of that EDI area, is very reassuring.
Great. So the next principle we're going to look at is empowerment. So trauma-informed organisations seek to identify people's strengths and what they can do, looking for solutions to challenges alongside people rather than for them. This approach comes from a place of supporting people to reclaim the power to take control of things within their own lives, rather than doing for them or professing to be the expert. In almost all cases, the individual is the only true expert in their own lives and how they want to live. And bearing that in our minds all the time in terms of the work that we're doing, and questioning ourselves forensically about whether we're actually professing to be an expert in someone else's life in the work that we're doing, can have a huge impact on the way that we respond to what they need and how we empower them to be able to move things forward for themselves. So empowerment means that we ensure that all voices are heard and that people are asked directly, what does empowerment mean to you? How can we help to empower you? It's not an easy concept. It's not something that when I ask myself that question, I can immediately come up with an answer to. But it's really important that we honour the people that we're supporting, to give them the opportunity to think about with you what empowerment looks like, rather than defaulting into a position of, you're the professional, you do for me. This can be really tricky because in busy and pressured work worlds with limited resources, it can often be easier to do for or to do to rather than with someone. And sometimes someone might need more help and support, but that this should be balanced always with one eye on that. What can they do for themselves? What capacity do they have in this situation so that we can share that support? How can I support them to get to a stage that they can do more of this without my support? Aside from being mindful of redressing that power imbalance or encouraging people to do more for themselves, it is also useful to consider that self-efficacy takes time, and your feedback on positive steps forward can have a huge impact on a sense of empowerment. Encouragement and motivation can be so empowering to somebody who perhaps through their experiences of trauma or adversity haven't had much of that. So supporting someone to move beyond needing services is about reflecting back some of those things that are going really well. So just as with the other principles, it's really helpful to name these behaviours and practices as being trauma informed. They all contribute to the wider effort of becoming trauma informed and make the wider goal feel more tangible and achievable if we're naming it, if we're seeing as what we're doing with our clients and our colleagues as something that could be seen as empowering. We need to be naming it. It's nothing to be ashamed of. Being in a position of saying, I think actually that activity was quite an empowering activity for the person I was working with. Name it and show that that's exactly what you're doing. We've now got a video from Michelle, so she's going to share her experience of empowerment.
I'm losing my children. Literally living on the streets for a short time until I got into rehab. And then I started doing voluntary work after about a year into rehab. And when I come out of rehab, so I moved from Harcliffe to St George. So I had to move right away from my area, my friends. A lot of them weren't friends, they were just using friends, but you know, associates, everything that was familiar to me, I had to move away from. And then doing voluntary work really helped me. I think the second step that I started with actually. And they knew I had very little self-esteem, but you know, so writing, you know, I won't met out with a client, I just take her for coffee and just write some notes down afterwards. I get a mental blank spot because everything's got to be perfect. I don't do it at all. But she was saying to me, you can just do it on tape and I'll write it all right. Is there anything I need to do to try and sabotage it? because I didn't feel I was good enough or worthy. She always had, like a bit like yourself, Joanne, she always had something, oh, we can do it this way, we can do it that way. It's like, they believed in me, I didn't believe in myself.
How does that make you feel?
Oh my God, it was $1 million, honestly. It really did. Wow. I grew up a little bit. But I've always been stunted emotionally. Made me grow up, made me find my voice. I was a bit of a people pleaser when I come around, because I was broken. I was totally broken. I didn't know how to live in this world without a drug or a drink. So it was learning to communicate with people. I felt very judged in the beginning. Then I found my Christianity that helped me in my faith. And that's got me through a lot of stuff. And yeah, just working for a firm that really, oh gosh, really helped me just be with myself. You know, and then they asked me to go for an interview. I was petrified. I've never been to an interview in my life, a proper interview for proper people. And you know what I mean, for a panel. And they knew I was nervous, and they was aware of that. They'd give me the job. And I think after that, because I felt I was valued, or I felt that I was enough, they must see something in me that I don't believe I got. I just thought, I'm going to show you, you know, and I really did put everything as my job. And I just sort of excelled then. Everything that I thought was going to be. So if I look back from where I was in Horcliffe, you know, losing my children, losing my house, my partner, because he wasn't ready to give up, so I had to choose between him and my kids. It wasn't any thinking competition, it was my kids. So I had to let go of a 10-year relationship to fight for my kids. And then to be in the real world and have a job, it was just empowerment. It felt empowered, yeah, that I was someone, or that I could be someone.
Oh, that's amazing. So finally, the final principle that we're going to look at this morning is choice and clarity. So fundamentally, choice and clarity is about the need to understand what a service is for, why somebody's there, how long they can expect support for, and what the service can and can't offer. Again, like some of the other principles, this might seem fairly straightforward as a concept, but in reality, too often people don't truly understand why they're there. Maybe the language used to explain a service was too laced with jargon or acronyms, or maybe they were in crisis when they were referred to you, or they were in crisis in their first appointment, so maybe weren't able to absorb all of what was said. Maybe there was so much information all at once that some of it was lost. And perhaps some of the information was presented in a format that was difficult to understand. So in practice, clarity isn't a one-hit thing. The importance of checking understanding and revisiting information at regular intervals to make sure that it's understood can be so powerful and ensuring that everyone's on the same page. So recognizing and reflecting on the fact that the paperwork we do in those first appointments, those first few weeks, might be fairly meaningless a few months down the line and runs the risk of coming into challenge where that person maybe hasn't fully understood. Checking in all the time on that understanding is so important to making sure that everybody knows what needs to happen. Choice can also bring up all sorts of tensions when supporting people facing multiple disadvantage, because often the choices available to them are few and far between, or maybe all of them might seem like undesirable options, so not really a choice. So whilst it might be difficult to support someone navigating limited choices, being honest and clear about those things, about not over-promising, and then really assessing where the options are and which one might be the best is really key to practicing in that trauma-informed way. Within the bounds of what's possible within your roles, it's really helpful to think about where there might be elements of choice for your clients and for your colleagues too, that you maybe haven't considered before. So offering a client the choice of where to meet you for your next appointment, for example, or a number of possible dates for sessions, or being able to steer the direction that works traveling, can all be ways to demonstrate that the relationship you're forming is one of balance and of one where there's choice, even where sometimes the bigger choices are those that aren't the best, giving the best options. Offering opportunities to take choice can be really empowering. So finally, let's listen to Ashna's experience of being given clarity.
So it was a couple of years ago. It was this charity who offered me trauma-informed therapy. So it was a therapy counseling which was designed to, to happen across 24 weeks. So it was 6 months long, and it was specifically for people who've experienced trauma after emotional, psychological abuse or domestic abuse or sexual abuse. So, and that was life changing for me, that time period, and them having that specific goal of, helping people who fall into a specific criteria. It helps you address the problem at its root. So yes, that was my experience.
Is that what the therapist did with you? You mentioned about going to the fridge.
Yes, I can say that that's what they did to you. I mean, from their perspective, yes, but when I went into it, I didn't really know what that would look like. But for example, in my situation, the root of it was that my trauma in today's life was it was coming from a lot of childhood trauma, which was trapped. And what it did help me realize, this therapist helped me realize that the reason why it was affecting me today is because there was this inner child, the child version of me, which was trapped and felt helpless and powerless and fearful and vulnerable. And every time I, hit something that was fearful or was difficult, it reminded me and took me right back into my childhood. So it helped me realize that there was always this child version of me, today. So that realization, because once you understand where it is, what it is causing that, then you can control it. Then you can manage it. So that's what they helped me realize, which I would have never found out if it wasn't for the therapist.
All right, I think you're done, Helen, aren't you? Wonderful. I'm going to pass back to Hazel, who's going to tell us, can we do it in 5 minutes, Hazel? What are the next steps from your point of view for these 6 principles?
Thank you. Yeah, I can do that in 5 minutes, no problem. I think it's just really important to highlight the importance of sessions like today, because increasing knowledge and skills amongst professionals is really a way of starting to embed trauma-informed practice into organisations. And that's not just about thinking how we're going to signpost to specialist services, although that's a part of it. It's really about the collective action we can all be taking in terms of how we're thinking about embedding these principles into the work that we do every day. And within Bristol, North Somerset and South Gloucestershire, a big part of the work that we're doing in the Trauma-Informed Systems programme and through my role is really looking to develop, I guess, a shared understanding and shared approach. So the things that we've been talking about today, so we've got that shared collective knowledge so that we understand what we're all talking about when we talk about trauma-informed practice and what is trauma diversity and how that really looks in practice. And I guess the trauma-informed principles are really at the heart of all that work. One of the ways that we're doing that, as Sarah J mentioned, is looking at the knowledge and skills framework as a real toolkit and a resource that everyone can look at. And that was a co-produced piece of work through a trauma-informed system-wide subgroup and also consulting with people with lived experience. And what it does is it aims to achieve that consistency of approach. And it just describes some of the practical steps that we can all be taking in terms of thinking about how to embed the trauma-informed principles into organisations and into the work that we do. And just a note on consistency of approach, it doesn't mean that the work that we're doing to becoming more trauma-informed will look the same in each organisation or part of the system at the same time. It really won't. We talk about trauma-informed practice, as Helen mentioned, as a journey and not a destination. It's really about that long-term commitment for us all. And in some areas, change will be seemingly a lot easier and it will look quite different, and the opportunities and challenges will look different for law enforcement agencies as they will for schools or a GP surgery or adult social care. So it's just a word of encouragement really around that, but the trauma-informed principles that underpin all of that work. And system-wide, we're really looking to create opportunities for individuals and organisations to come together, share good practice, to keep up to date with, I guess, the growing evidence base around this, and to network and talk through some of those challenges around embedding trauma-informed principles into practice. So there are networks that already in Bristol and South Gloucestershire, and we can circulate details of those, and there's work underway to develop that across Bristol, North Somerset and South Gloucestershire as well. So really encourage you to get involved in them, because it is a bit of a problem solving place where we can come together and learn more and kind of think about this and have it be a really living and active thing for us all. Another thing we're trying to do through my role is to, I guess, raise awareness amongst those in positions of leadership who have strategic influence, but who also the decision makers often in terms of resource and in terms of how services are going to be designed and delivered. So a big part of my work is looking at that and engaging people in those positions to help them understand it and help everyone get on the same page. And really working on an ongoing basis with people with lived experience and groups of lived experience, just to gain that ongoing insight, which, as you can see from today, is so valuable in thinking how the work can be developed and delivered, and getting their insight and their understanding about what this means in practice and how this feels for them, because that's such a powerful message. And I think it's really important that that remains at the heart of everything that we do, and really in keeping with the principles in that way. I think that's everything I'll say, because I know that I'm conscious of time, so I really want to give the opportunity for some of you to ask questions and to be able to respond to those as well.
Wonderful. Thank you, Hazel, Ellen. And of course, thank you very much to our Independent Futures members. So that's Tom, Michelle, Ashna, Dujon and SJ. Really grateful for their video testimonials today. So do feel free to add questions to the Q&A box. I'll actually kick us off with one. For someone who is new to trauma-informed practice or doesn't feel too confident about this, what would be the first steps in applying these principles?
I'm happy to start with a bit of an answer. So I think what we'll do after the session is circulate a link to, we've made a poster with the 6 principles on in Changing Futures, and we'll share a link to that so that you could perhaps print that, because one of the things that I found really helpful is having those 6 principles visible to me, so that they're just a kind of aid memoir, if you like, to the things that we're really trying to do. So I think as a starter for 10, it's really getting those kind of key things in your mind about what's important in recognizing trauma in the people that we work with and supporting that relationship building. So those 6 principles, the biggest thing they do is to support us to build really strong and secure, safe relationships with the people that we're working with. So those are the key, that's the key thing really, is relationships are everything in trauma response. So actually I think holding that at the center and thinking about how can I be behaving in this relationship with those 6 principles in mind.
Another question that's come in, do we have any tools or methods of assessing the impact of trauma-informed practice?
That's like a golden question. So in terms of assessing impact, I'm happy to share, I guess, what we're doing in terms of my trauma-informed system program. So my role is to really oversee trauma-informed practice on a system level, that being in Bristol, North Somerset and South Gloucestershire. Much of this is so much about, I guess, how we reflect on what we're doing and how that's working. So in terms of how I measure the impact of the work that we're doing on the system level, it's very much thinking about that. It's thinking about, you know, what's our aspiration? What do we hope that we're going to achieve through what we're doing? What are the things that we've done? What are the outcomes that we've seen? But also just to like think about what's enabled us to get there, and what have been those blocks and barriers. And I think that those sort of process of thinking about that systems change in that way is really important, because it helps our ongoing learning. And it's the challenge is of that, what, you know, how's what I've done caused this and has it caused this? But I think so much of that is also about bringing in the experience of people with lived experience and actually asking them and helping them to reflect on actually, you know, what's worked well in this session, or what's the impact been as me as a worker, and how I've, you know, my relationship with you, like what difference has it made to you? And I guess being really mindful of the principles in all of that reflection, because then you can draw out, actually, you know, you helped me to decide this for myself and I felt empowered to do so. Well, that's thinking about, actually, well, that's trauma informed, and what I've done therefore is worked in a trauma informed way with that person. So I would just encourage probably not very friendly, but very useful Excel spreadsheet to start thinking about those things and putting those categories. And I can maybe share a bit of a pro forma of how we do that. But it is challenging, and it's a challenging thing for people to realize, because it has that long-term commitment is needed. So actually for some people, those really small steps are really monumental for them. But actually in terms of achieving those enormous goals of life changes, it's hard to demonstrate that sometimes. But actually for people's individual lives and the daily interactions we have with them, that's what can be life-changing as well. So for commissioners and funders, that's not necessarily the answer they want, but for the lives of the people we're trying to serve, it really is so impactful.
So someone says, yes, they would find a pro forma really useful, Hazel.
Yeah,
so maybe you can
sure.
share it with me, and then I'll email it together with the link of the recording. There was also another question for you, actually, Hazel. Is there a link to the network that you have mentioned?
Yeah, I can send. So at the moment, there's a Bristol-based one and there's a South Gloucestershire-based one. So depending on where people are based, I suppose. But I can definitely send. Again, shall I circulate the email addresses to you, Sarah Jane? Is that the easiest thing? And then you can send them out to the group. And I'm happy for my email to be in there as well, because if there are people working in North Somerset, that work's definitely evolving, and that's, you know, their aim will be to kind of create this across the system too. So I'm happy to stay in touch with anyone who's got an interest, and then sort of keep you up to date as and when those opportunities arrives, for sure.
Wonderful. I think it's time to wrap up. I can't believe that it's been an hour and it's nearly 10 o'clock. So once again, thank you so much, Hazel and Helen. That was really useful, and I can already see on the feedback there that loads of people have found it really valuable. So well done. Just one more time, a huge thank you to, actually, I forgot Corrado earlier, Corrado, who's our IF manager, who interviewed Ashna, Dujan, Michelle, SJ and Tom. So thank you all for their contributions. I wouldn't be a very good comms manager if I didn't say that our next webinar is on the 25th of May, and that one will be looking at implementing the My Team Around Me approach, which is a key part of our Changing Futures programme. So I will also share the link to that webinar. As I said, I will be sharing the link with everyone and the information that Hazel will be sending me. And I wish you all a really lovely day. Thank you.